Good morning, everyone. It's been a month since most of our students went back to school. We continue to monitor the situation closely, and I'm very pleased that our schools continue to be safe places to learn. While we are reassured that COVID-19 transmission in schools remains low, we know we need to remain vigilant and be ready to respond quickly to potential cases and outbreaks in the context of the Delta variant, especially in areas of high community transmission. COVID-19 vaccination and extensive public health measures in place remain the primary responses to prevent the introduction of transmission of the virus in school and childcare settings. While vaccines and strategies such as masking, cohorting, and daily symptom screening measures remain the best defense against COVID-19, screening and testing remain important tools in protecting against the spread of COVID-19. To further help our schools remain safe and open, the province will support the implementation of rapid antigen screening for COVID-19 in specific schools and licensed childcare settings on the direction of the local medical officer of health. This school-based program is in keeping with current provincial guidance for rapid antigen screening and based on advice from Public Health Ontario, the Ontario COVID-19 Science Advisory Table, and Ontario's Testing Strategy Expert Panel, and it's focused on screening of children in public health units with the highest risk of transmission. Where the risk of transmission is very high and vaccine coverage is low at the community or school level, this measure may provide an additional layer of protection for schools and child care centers to minimize risk of outbreaks and potential closures. Routine rapid antigen screening of fully vaccinated individuals and children is not currently recommended given the effectiveness of the COVID-19 vaccines, as well as the risks posed by the disruption of learning as the result of false positive tests. This COVID-19 rapid antigen screening for childcare and school-aged children will proceed in the following manner. Local medical officers of health will determine if rapid antigen screening will be implemented in their region to local factors and needs. Where the public health unit has identified a need for rapid antigen screening in schools or childcare settings, tests will become available. This testing would be voluntary. Parents will be able to choose if their children participate in this screening offered by their schools or licensed childcare settings. Rapid antigen screening will be used only for unvaccinated, asymptomatic students and children who are not high-risk contacts, as in participating or in an outbreak. People who are symptomatic and high-risk contacts should continue to access lab-based PCR testing at assessment centers and other specimen collection centers. Unvaccinated, asymptomatic children will be able to conduct the rapid antigen screening at home and will be provided with instructions and necessary supports. Children who receive a negative result on a rapid antigen screening test will continue in-person learning. Children who receive a positive result will be required to seek a lab-based PCR test at a local assessment center or specimen collection center and will need to isolate until the result of that lab-based PCR test is known. Targeted asymptomatic screening could help detect cases in schools earlier and reduce the risks of ongoing outbreaks and or closures, particularly in communities across the province that have a high prevalence of active COVID-19 cases. It is another tool in our tool chest to help keep schools safe and keep students in the classroom where they thrive. I'd like to again thank Ontarians for continuing to follow public health measures and advice that is in place. And I continue to encourage everyone who has not yet to get their first or second dose of the COVID-19 vaccination to do so as soon as you can, to increase our community immunity and protect our young Ontarians who are not eligible to receive the vaccine as of yet. Thank you.
We'll go to the floor for questions. One question, one follow-up.
Dr. Moore, last week the Kitchener company that was supplying kits to parents was told by the Ontario government to stop. I'm just wondering why, and if parents wanted to take this on themselves and add an extra layer of protection, what's the harm in that?
I believe the Kitchener program, and I'm not familiar too much with the details, was part of the PASS program. The PASS program was for businesses only. They had specific objectives and deliverables for that antigen testing program, and it was not to be used in schools. Now we do have a tool to be used in schools that will be available based on a decision by the local medical officer of health in partnership with the school boards and parents, and it should be a targeted, high-risk strategy to keep schools open. That is the best advice from Public Health Ontario, from our testing team, as well as the expert panel.
Just on a separate topic for a colleague of mine, Thanksgiving weekend is coming up. What would be your recommendation to families that would like to get together this weekend?
So on Thursday, we're going to announce the recommendations for Thanksgiving. We'll also mention for Halloween. But in a nutshell, if you're having family over and you're completely vaccinated, if you feel comfortable removing your masks, that would be absolutely appropriate in a fully vaccinated group. We still have the reopening of Ontario maximums of 100 outdoors and a social gathering and 25 indoors. Those should be adhered to, and I think those are reasonable and safe numbers. If it's a mixed group of vaccinated and unvaccinated individuals outdoors, you may consider keeping masks on, and certainly if you go indoors, I would suggest you keep your masks on in a combination of groups of vaccinated and unvaccinated, particularly if you're vulnerable to this virus. So if you're older, you have any chronic medical condition, and you're mixing with unvaccinated individuals, I would suggest keeping your masks on. And certainly anyone that goes into a social environment where we're close with family members, you'd want to screen for any symptoms of COVID-19. If you have any symptoms consistent with COVID-19, you'd want to be tested in advance and ensure you know the results before you go to a social setting. Every long weekend like this, especially Thanksgiving, where it's a social event where we have families getting together, we want to minimize the spread. We want families to embrace the opportunity to get back together for their mental, physical, social well-being, and we'll have that list of recommendations available on our website soon, and we'll announce it on Thursday as well.
Yeah. Hi, Dr. Moore. First question is, the Premier's office has been pointing out that till now, the Testing Expert Advisory Panel, Ontario's COVID-19 Science Advisory Table, and yourself have all been advising that widespread asymptomatic testing of students isn't recommended because of its impracticality. Is this still your position, or do you feel that the announcement you're making today clashes with that?
No, it doesn't clash.